Welcome back. Measles is spreading across the country, and public health officials are becoming alarmed. Health officials are reporting cases of the highly infectious disease in more than a dozen states, including Georgia, Maryland, California, and Florida. New Jersey has also confirmed a total of 3 new cases, which, under CDC guidelines, constitutes an outbreak. But the most extensive outbreak is concentrated in the Southwest. 223 people in Texas, mostly West Texas, have been infected with measles. Officials have also recorded 33 cases in New Mexico. Omar Villafranca joins us from Dallas. Omar, what is it that Texas health officials are doing and saying about the situation?
Well, Major, they're really working with the local doctors on the ground to give them the information and vaccines, if they can be used with the community, to administer them. Listen, this outbreak is starting in a small Mennonite community in Gaines County, Texas, in West Texas. You mentioned 223 cases. 156 of those cases are in Gaines County. The Mennonite community is several thousand, and they are a small Christian group. They are unvaccinated. They're wary of Western medicine. So one of the doctors who I was talking to there says he treats some of those patients and he tries to get them to get the vaccine. They're just not going to do it.
What about RFK Jr., the HHS secretary? His comments about this in general, and how are they being received by doctors nearest to the outbreak?
Well, listen, I can tell you I've talked to several doctors who are treating patients on the front line. One, when he was in the Oval Office and said that of the 20-plus patients who were in the hospital that they were quarantining, Dr. Laura Johnson at Lubbock Covenant flat out told me that is wrong. That is incorrect. Now, I asked Dr. Wendell Parkey, who's in Seminole, Texas, there in Gaines County. This is what he had to tell me when I brought up RFK.
We were talking about RFK, or Secretary Kennedy, and he's mentioned steroids and vitamin A.
I think it may help, but it doesn't cure it. The MMR, the old vaccines are very well researched. We know that they're safe. And there's other thing, you can't be taking vitamin A forever. You take too much of it, it's bad for your bones.
Major, talking to Dr. Parkey, he told me it's a dance he has to do. It's a fine line he has to do. Does he want them to take the vaccine? Yes, but they're not going to do it. He wants to inoculate them, but he doesn't want to isolate them. He wants them still coming in for treatment, and that's his dance out there in West Texas as this spreads. And keep in mind, one more thing I want to add. The state updates the numbers every 2 weeks. When we see it grow by 20 or 30, most of the cases are there in Gaines County with that Mennonite community.
Omar Villafranca in Dallas, thank you very, very much. I want to bring in CBS News Chief Medical Correspondent Jon LaPook now for more on all of this. Dr. LaPook, again, we had a conversation about 10 days ago. We don't want to alarm people, but we don't want to withhold potentially bad information. So how bad could this get?
Well, you know, it's bad for the person who's unvaccinated, who gets very sick, gets hospitalized, or we've seen could even die. So right now, in terms of people who are out there and being, wondering, how's this going to affect me? If you're vaccinated, or if you've had measles, if you've had 2 doses of vaccine, you're going to be okay. You're protected. But in terms of how bad it could get, it's in these pockets all around the country where you have areas where you're not getting vaccinated, hesitancy. And that's really the problem. And also the fact that it's a 10 to 14-day incubation period means that every time you see an outbreak, we're hearing somebody was in an airport, somebody was in a hair salon, somebody was in a supermarket. Well, they could have no symptoms. In fact, you could be shedding the virus and infecting people. It's so infectious 4 days before you even get a rash. And that's why you have it traveling along and ricocheting around the United States. And so we don't know where this is going to end. I mean, the end of the day, it's the vaccination that really is going to stop the spread.
And I've heard mention, Dr. LaPook, of boosters. Who should think about a booster? What is its utility? And how do I think about whether I should or shouldn't get one?
All right, I'm an internist, too. Internist in gastroenterology, so I'm getting this all the time. I'm going to actually, even if it takes a little time, let's slowly explain this because people are really confused. CDC says if you were born, before 1957, the odds are that you got the measles. And if you got the measles, then you're immune forever. If you know that you got the measles, you're done. Now, from 1958 to 1968, that's the tricky period. If you were born after 1957, then from 50 ate until 63, which is when the vaccine came out. Vaccine came out, we see the graphic up there, dramatic drop in measles. But what if you were born in 1958, 59, 60, 61, 62, and you didn't get that vaccine? We don't know whether or not you got measles or not. So if you don't remember whether you got the measles, that's a period where you probably should go ahead and get a booster because you don't know. If you got the measles, you know you have a record, or your mother told you, if she remembers, you're fine. Now, trickiest is 63 to 68. Why is it so tricky? The vaccine came out, and some people got the much more effective attenuated virus. That's it's live, but it's weakened. And some got the much more ineffective, the much less effective, dead, killed virus. You probably don't have the records of that. So if you got vaccinated 63 to 68, you don't know which one you got. And you might as well, if you don't have your records, you could do one of two things. You could just go ahead and get boosted, which is what the CDC says. Look, you know, it's actually no big deal. There's no downside to getting just a booster if you're not sure. Or you can check your titers, your blood test, and see, are there antibodies to the measles? So it's a little bit of a tricky answer, but that's it.
But basically, if you're in doubt, it's okay to get a booster.
You can get a booster twice, yeah. You can get a
Robert F. Kennedy
vaccination
Jr.
twice.
has talked recently about vaccines, meaning the measles vaccine, undercutting natural immunity within mothers, and this being part of the conversation or something that should be more a part of the conversation. Can you talk about that?
Yeah. So, you know, if you pull out the microscope and look at the big picture, what's so important in public health and in your job is you don't want to bury the lead, okay?
No.
The lead here is that if you look at, say, the about 20 kids who are hospitalized, in Texas, all 20 of them were unvaccinated. We crunched the numbers this afternoon with our team, and it turns out that in the people who you know whether they were vaccinated or unvaccinated, about 95% of the people who got measles were unvaccinated. So that's number 1, 2, 3, 4, and 5. We know that the people who are getting measles were unvaccinated. We also know that if you get 2 doses, you have 97% lifetime immunity. 1 dose gives you about 93%. So, yes, there is some maternal antibody that crosses the placenta and can protect the child for several months, 3, 4, 5 months. You can't rely on that. That's why they don't give the vaccine until 12 months, because it's less effective if you've got these antibodies from the mother that are gobbling up the vaccine, right? So you wait. In terms of the immunity wearing off over time, yes, you can find some studies, you can cherry pick and find that the antibody titers can go down in some people over time. But at the end of the day, you have these memory B and T cells, these immune cells, that even if your levels, you can't quite detect them high enough in terms of the standards, when you see the measles, they spring into action and they give you protection. So that's why they get the 97% lifetime protection if you have both doses. So again, communicating public health data is really tricky. You have to do it in the certain order. The most important thing that you say in a story, right, Major? It's the first thing you say. The second, what's the second most thing that you say? The second most important thing. And so I think, one of the issues that my colleagues have with the advice that we're hearing from government right now and from RFK Jr. is, these are tricky things to communicate. I don't doubt his intentions, but every word is important. And when you say, well, some people it wears off, what do you mean some people? How many people? Give me the numbers. Give me the evidence.
Right.
We're talking about evidence-based medicine, and I think it's really important. I think it's important to have people who are trained in science and trained in communication to do this public health communication, because it's tricky, even with people with the best intentions.
It's tricky, but not for Dr. Jon LaPook. Doctor, always. Thank you very, very much.
Take care.
How spending